Hi, my name is Dr. Gupta. I'm from Team Nivaran in Mauritius, and today, after a lot of research from our front office, from our reception, from our physical therapy team, they wanted me to talk about prevention, because we have always been talking about cure. We wanted to talk about prevention, how we can look at preventing low back aches, how we can prevent chronic long-standing neck pains, back pains. So why would this thing become so common these days? The back pain or the neck pain is basically primarily because of our lifestyle. That needs a change. The people in the earlier times were not having it that much. The first thing that needs to be changed is the way we are sitting, the number of hours we are sitting at a stretch. So most people these days are spending their time in front of the PCs, laptops, either for official work or for watching movies or for watching programs on Netflix or whatever web series they are watching. So that leads to a lot of bad posture on the neck, on the lower back. When you're sitting for long hours, your back gets the maximum pressure, and that too, if you're sitting hunched back, you're sitting slouched, it causes a lot of mid back pain or lower back pain. So the basic essence is we need to make sure that we are able to keep our postures corrected. The second thing that we wanted to highlight was the fact about exercises. Most people talk about, yes doctor, I go to the gym. See, gymming is good. It is a generalized well-being which you are practicing there. But in gym also, sometimes in terms of competition, sometimes in terms of lack of proper training, we get into wrong postures while we are doing some exercises, which again leads to severe pains. I mean, we frequently see the patients doing lower back exercises like deadlifts or the rowings, wherein they have got a pull or a jerk because of a wrong posture of doing the exercises. So again, we should look at doing all these exercises in the gym under a particular trainer, so that we don't get into these injuries, because if these injuries happen, these are long-term injuries which take long time to heal. Thirdly, in terms of exercises, try and do more of brisk walking, cycling, swimming. These are the exercises which are helping your lower back, specifically the core group of muscles. So your pelvic exercises, your planks, your side planks. If you're looking at doing exercises, do more of your core strengthening and the lower back extension strengthening. Posture management, exercises, and third comes the importance of diet. So many people tend to be gorging on fast food. They miss out on good amount of dairy products. People who are vegans or who are vegetarians, they tend to miss out on a lot of non-veg thing, wherein they could have had a good amount of vitamin D, calcium from the diet, which is in turn important to maintain the normal circulation of our neck muscles, our back muscles, the bones, and the strength in the ligaments. So this is as far as the prevention is concerned. But if you are having any back pain which is consistently increasing in intensity, it is radiating down to your legs, your arm, you're getting anguji, numbness in your hands or your arms or your legs, you need to be seeing a doctor, specifically for spine, a trained doctor, so that they can set, after diagnosis, a clinical examination, they are able to understand if it is a mild issue or a moderate or a severe issue, in which case you might need an investigation, which will then lead you on to a MRI, which shows either it is a slip disc or a bulging disc which is causing pressure. Now again, everybody is scared of a slipped disc. I have a slipped disc, I don't want to do anything in life, my life is ruined. These are sort of things that we hear in OPD day in and day out. And I like to sort of set the record straight. There is nothing like my life is ended with slipped disc. It never will happen, because somebody with a disc bulge or even a disc which has come out, naturally the healing process is such that about 80-85% patients will get better without doing any treatment or any other intervention. That's where the nature takes care of that. But in about 18-20% of cases, which is the international data we are quoting, the pain persists post the first 4 to 6 weeks. That's when you're looking at doing some sort of an intervention or treatment for that. Again, the treatment or the intervention depends on not what the doctor wants or the patient wants. It depends on what the disc wants. So if it is a contained disc, we go in for a disc decompression with a biculoplasty, the laser. We just shrink the disc. If it is a slipped fragment which is lying outside the disc and causing pressure on the nerve or the spinal cord, in those cases we sometimes, just with the help of endoscope or a small camera, we go inside the spine under X-ray guidance and we remove the disc in total, and we are able to remove the compression right away. This procedure of endoscopic disc decompression is something which is done under local anesthesia without any hospital stays for long, no immobilization from work. Patients can actually go back to work within 5 to 7 days of these interventions. As far as the third case is concerned, wherein there is severe compression in the spine, there is old age, the bones have got used up or the bones have become very thick, the ligaments have tightened up. In those cases also, when we need to do open surgical release, in our cases we are doing most of those cases under microscopic vision. So we are doing a micro decompression, a microtubular decompression. That's where we are able to achieve the results with the minimalistic of incisions. Only in the very rare cases where there is instability in the spine do we need to sort of add on with some implants or screws and stuff to achieve fusion. Otherwise, the need for fusion is less than 1 out of 20 cases of spine which are getting operated. But unfortunately, sometimes the number of cases have recently increased in this country. But having seen the data, the international data, it does not support doing fusion for each and every case because the rate of fusion achievement is also very less. So this is an introduction sort of a video in terms of the prevention and a broad overview about the treatments which are possible for a disc problem. In our next series, we will sort of try and take care of particular disc in question with some MRI images and try and solve your questions, so that every fortnight we are touching upon a problem related to the disc. So this one was the first video. We'll go in with a few more videos, at least 3 or 4 in the next 15 days. Every 15 days we'll have a new update wherein you can be on our page and you can follow us regularly for getting updated and information about these disc issues. Thank you.